After a substantial and uninterrupted decline in the levels of conceptions in girls under the age of 18 in England and Wales for 14 years, progress has stalled. The levels of conceptions in girls under the age of 18 in England and Wales are slowly beginning to rise. Why did this happen? What are the implications of this for the United Kingdom government? And what are the lessons that governments from low and middle income countries can take from what has happened in the UK? That is the focus of my presentation. Namaste. My name is Chandra-Mouli. I worked for the World Health Organization between 1993 and 2023. For much of these 30 years, I worked on adolescent health. I retired from this great organization in August 2023. I continue to work on adolescent sexual and reproductive health and rights independently, on a no-payment basis, and on issues that interest and concern me. Adolescent pregnancy and childbearing is one of these issues. As shown in this slide, in England and Wales, conceptions in girls under the age of 18 declined between 2007 and 2020, year after year. That ended in 2020. There were slight increases between 2020 and 2021, and again between 2021 and 2022. However, the levels are still below the 2019 levels. Another issue is that inequities in the levels of conceptions in girls under the age of 18 in England and Wales between richer areas and poorer areas has always been an issue for decades. That gap had begun to shrink. Sadly, progress even in that area has stalled and the gap is slowly increasing. The vast majority of adolescent pregnancies and childbirths are in low and middle income countries. In these countries, the fertility rate in adolescent girls aged 15 to 19 has nearly halved in 30 years, as you can see in this slide. The rates in girls between 10 and 14 has dropped even more dramatically. There has also been progress in the desired direction in two other areas. One is in the reduction in the levels of child marriage and reductions in the levels of unmet need for modern contraception by sexually active adolescents. Finally, although we don't have concrete data, we believe that the levels of abortion are increasing because of increased access to medical abortion and the active promotion of self-care. England's 10-year, multi-sectoral, multi-agency, multi-level teenage pregnancy strategy was a model for the world. It was emulated in many countries. That strategy contributed to preparing and supporting young people, boys and girls, to make well-informed and well-considered choices on pregnancy and parenthood, and more importantly, to act on them. This solid public health approach was grounded in wider approaches with a social inclusion lens to address the socio-economic drivers of early pregnancy and poor outcomes during pregnancy, during childbirth, and during early parenthood. Adolescent pregnancy prevention is on the global and regional political agendas. It is also today on the agendas of most countries. Over the last 15 years, the last 5 years of the Millennium Development Goals era and the first 10 years of the Sustainable Development Goals era, there has been tangible progress in a number of areas, ranging from generating evidence through research studies and evaluations of programs and projects, to taking this evidence and applying it to shaping and strengthening policies and programs. England's 10-year teenage pregnancy strategy ended in 2010. The government which was in power then decided not to renew the strategy. Despite that, progress continued because of the efforts of people within government and outside government. But over time, the progress slowed and it has now stalled. According to Alison Hadley, who led England's teenage pregnancy strategy, one of my heroes, complacency that the rates are down and so the job is done contributed to this. At least three other factors are related to this. Firstly, the sharp cuts in government social spending, which led to a crumbling of the systems and structures that had been put in place. Secondly, the cost of living crisis that has led to poverty and deprivation in some segments of the population. And thirdly, effective communication by social media influencers, which has led to many young women believing that hormonal contraception is bad for their health. Over the last 30 years, a number of low and middle income countries have made impressive progress in reducing adolescent fertility, as I have described in a previous slide. This did not happen by accident. Their governments, non-government organizations, and a number of other civil society bodies worked together to achieve this. They were supported by a range of external, technical, and financial partners. With the sharp cuts in overseas development assistance from a number of governments, including that of the UK, this hard-earned progress is at the risk of unravelling. What are the implications of this for England and Wales? Alison Hadley, whom I mentioned earlier, calls for strong national leadership and a refocused national effort to address teenage pregnancy and its social determinants. Polly Toynbee, writing in The Guardian, calls for creating public understanding and support for the teenage pregnancy strategy and initiatives such as this, so that future governments in the UK do not do what governments between 2010 and 2025 did, social sabotage, as she calls it. The implications of this for low and middle income country governments are that if programs to provide sexuality education, to improve access to and uptake of contraception, to reduce child marriage and other related issues are stopped or are diminished, a reversal of the gains is on the cards. And this could affect, firstly, communities who are deprived and marginalized. Secondly, low and middle income country governments must realize that they cannot rely on governmental agencies or foundations from high income countries to support these efforts substantially and indefinitely. Resources for this must come from within. A key lesson for international technical and funding agencies is that if a highly resourced and well-integrated national strategy in the UK, a G7 club member country, could not be sustained over time without governmental leadership and governmental funding, expecting this to happen in a low and middle income country without extensive preparation and some ongoing support is foolhardy, to say the least. A key lesson for high-income country governments, such as the UK, is that sexual and reproductive health and rights must continue to be high on the political agenda. I'd like to make 2 points in relation to this. The Lancet Commission on Adolescent Health and Well-being recently published its report, in which it places the UK within a category of countries which it calls non-communicable diseases predominant, which could be interpreted as suggesting that sexual and reproductive health is not a really big issue in this country. That is nonsense. Even if maternal mortality rates are not high, and unsafe abortion rates are not high, and deaths from HIV are not high. There are other issues, such as the explosion of sexually transmitted infections such as chlamydia, such as the decline in condom use and hormonal contraceptive use because of social media influencers and other issues, and because of the growing anti-girl, anti-woman sentiment and action in the cyberspace and in the field, on the ground. Similarly, the publication of the Child and Adolescent Health Strategy for Europe, supported by the regional offices of WHO and UNICEF, do not make an explicit reference to sexual and reproductive health. I just can't understand this. This makes no sense. To conclude, over the last 30 years, the world has made tangible progress in reducing levels of adolescent pregnancy and childbearing. This has occurred from the richest to the poorest countries of the world at enormous effort and enormous expense. What has happened in the United Kingdom, and specifically in England and Wales, has shown us that without strong advocacy, this progress could breed complacency, which in turn could reduce the level of political support and investment, with disastrous results. For those of us who care about the adolescents of the world, today and tomorrow, we absolutely cannot allow this to happen. Thank you and namaste.